you are in the world. This is Dr. T, and it's another edition of Sickle Cell with Dr. T. I am Dr. Adisoye Oluwatosin, and this time is going to be a short one. I just want to talk about priapism and sickle cell disease. What is priapism? How does it relate to sickle cell disease? Can anything trigger priapism? How can priapism be managed? Can it be managed at home? What are the complications of priapism? How do we avoid the complications of priapism? All those questions you will have answers to after this lecture. So let's go there. What is priapism? Priapism is an unwanted, prolonged, and painful erection of the penis in the absence of sexual arousal, or a painful and prolonged erection of the penis long after sexual arousal has stopped. This lecture is mainly for the men, for the male gender. So, when you're sexually aroused, you can have an erection. Imagine having an erection without being sexually aroused. And it's not just an erection, it's a painful erection. That is what is called priapism. Or you possibly were sexually aroused, but an hour or 2 hours or 3 hours after your sexual intercourse, you still have a painful erection. Then that is also priapism. Priapism is one sickle cell complication that has devastating side effects or complications. A complication that has devastating complications. But it can be avoided. But I think our health professionals do not educate people about this complication enough. It is the right of every male living with sickle cell disease or every caregiver of a male warrior to be educated about symptoms of priapism, management of priapism, what to do when a warrior has priapism. And we hardly do that. And this is a complication that has devastating consequences. So it will be better, I will implore health professionals to take their time to educate warriors about this complication. Take your time to educate them about priapism, what to do and what not to do. So we have 2 types of priapism. We have the ischemic and the non-ischemic priapism. The non-ischemic is usually caused by trauma, but the ischemic is the type that we have in sickle cell disease. And it happens just like a sickle cell crisis happens. Priapism is a form of sickle cell crisis. It's a form of vaso-occlusive crisis. It's just like crisis of the penis. That's what it is. We say red blood cells are sticky. Instead of being fluidy, they are sticky and gel-like, and they block blood vessels and impairing blood supply to organs and oxygen supply. That is what happens in priapism. The sickle red blood cells block the blood and oxygen supply to the penis, thereby leading to the erection and the pain. There are some things that can trigger priapism. Don't get me wrong though. Although we have triggers, a crisis or priapism can happen with or without triggers. But staying away from triggers might reduce the rate at which you have priapism. It might help to reduce the rate. And the triggers of priapism include: number 1, every trigger of sickle cell crisis I already said priapism is a type of sickle cell crisis. So all the triggers from dehydration, hypoxia, infection, acidosis, all these triggers, extremes of temperature, they can all trigger priapism. So avoiding triggers of sickle cell crisis can help you avoid frequent priapism. Some other important triggers of priapism are alcohol, smoking, recreational drugs like marijuana, cocaine, some kind of antihypertensive, antidepressant can predispose to priapism. Some herbal concoctions being used with antipsychotics can predispose to priapism. The normal early morning erection can predispose to priapism. Sexual intercourse can predispose to priapism. Not all precipitating factors or predisposing factors can be avoided. You can only manage some. Can you manage? No, let me start with the complications of priapism. Complications of priapism. If you have priapism for more than 4 hours unattended to, you are at risk of having erectile dysfunction. You're at risk of having penile shortening when the penis has undergone fibrosis due to ischemia, inadequate blood supply and oxygen supply. It's going to become necrotic and it begins to shrink. That is why it causes penile shortening. We have a penile gangrene, becomes infected and becomes gangrenous. All this can lead to infertility. When you do not, so this is why it is necessary to manage priapism on time and not just take it as just another crisis. Is it no crisis? The pain will just last for 1 day and it will go away. No. Priapism is more than just a crisis. It's a crisis that can leave a devastating mark if not attended to properly. That is why people need to be educated about priapism, because actually both children and adults living with sickle cell disease can have priapism. So when you have priapism, what should you do? Okay, number 1, learn to empty your bladder. Yes, a full bladder enhances erection, thereby enhancing priapism. So before you sleep, empty your bladder. When you wake up, empty your bladder. It helps. Take a lot of water to enhance blood flow. Take your analgesics, your pain reliever. Exercise, walk. Maybe you should walk through steps, walk around. If you've done all this, and the priapism has not resolved, please, after 2 hours, go to the hospital. Although it is 4 hours, I mentioned earlier that, okay, you'll be at risk of those devastating complications if it reaches 4 hours, but you cannot wait for that 4 hours before going to the hospital, because let's talk about transportation. Getting to the hospital might take time. When you get there, being attended to at the A&E might also take time. So to avoid all this, is better if it is over 2 hours and you still have priapism or your child still has it, go to the hospital immediately. I want to say this. People think it is okay to use ice block helps with priapism. No, it will make it get worse. So don't use ice block. Don't use ice pack when you have priapism. If you are living with sickle cell disease and you have priapism, never use ice pack. it will make it get worse. And to health professionals, please, many times, all this, you see a client who has sickle cell disease that you've been managed, and you've never, as a child, a male child with sickle cell, and you've never mentioned priapism to them. That's criminal. You've never educated them about the dangers of priapism, what to do if their child has priapism. We do not. We always forget. Many times we educate about crisis, how to avoid general crisis, how to take hydration and stuff, and we forget about complications like this. Please, let's do better. And it's not every crisis that is, I will sleep. When I sleep, the pain will go. When I stay at home till tomorrow, I won't go anywhere. If you have priapism, go to the hospital. If you manage priapism on time, it will not cause all those complications. It is when you do not manage it properly or on time that it can lead to the complications that I mentioned. If you are having priapism too frequently, it's an indication for hydroxyurea therapy. It's an indication for chronic blood transfusion. All other treatments like irrigation or aspiration will be done by your doctors. And a patient for priapism should be managed by a hematologist and urologist. Take charge of your health and take proper care of your health or your child's health. This is all I have to say today. Thank you.